So, I mean, that's actually a little bit of a personal story too. My best friend growing up, his older brother had schizophrenia, and we sort of witnessed him, when we were in middle school, just really kind of fall apart in psychosis and alcoholism, and he ended up dying young. It was really tragic. So I sort of always thought to myself, like, wow, that is a serious situation, and something that I wonder if I could ever, help in a situation like that. Fast forward, I'm in, undergrad and studying everything. And yeah, I started as pre-med and decided not to do it. And then I went back and did pre-med classes and went to med school. And I had an idea when I was going to med school that I wanted to be a psychiatrist with sort of that story in mind. And also a distant relative of mine had schizophrenia as well, sort of a great uncle. And I always heard stories about him. He was sort of a musical genius, but, was psychotic his whole life. And so, I just sort of had this in my mind. I always had a fascination with people with who had psychosis as a thing. As an undergrad, I studied some philosophy. I studied shamanism. Just these types of things really always fascinate me. Psychedelics at the time, I was very fascinated about. Um, and so, I decided that psychiatry was the place that not only could I do a lot of good, but it's something that I think would be interesting throughout my whole career and probably would change a lot through my whole career. And here we are now, and I think I was right back 25 years ago when I made that decision.
Wow, that's awesome. Please don't assume that our listeners have the same level of ignorance that I do. This is a very ignorant question and coming from me. Remind me, I should know this, but remind me what's the difference between psychiatry and psychology?
Oh, yeah, of course. So psychiatry is a branch of medicine. So you go to medical school and then you do a residency. First do a year of internal medicine training after, or what's used to be called an internship, and then 3 years of psychiatry training after medical school. So that's a psychiatry training, and have the ability to prescribe medications. Usually there's psychotherapy training. I was definitely heavily trained in psychotherapy and still practice as a therapist. But there's that combination of being able to do the medical part as well as the therapy part in a psychiatry training. Whereas psychologists are either, they can be PhDs or master's level clinicians, or there's a PsyD degree as well. My wife is actually a PsyD, she's a psychologist. And so they're studying more the psychology, the mind, and psychotherapy. Some PhD psychologists end up doing, neuroscience research, but there's not that medical training quite as much. Yeah.
Got it. Okay. Thanks. I appreciate that.
Yeah.
Okay, so what was it like? What did you assume it was going to be like? And then what was it actually like when you started practicing medicine? Were you making huge leaps and bounds? Were the things that they were teaching you like really helping a lot of people? Like how did that kind of evolve over the course of your career?
Yeah, great question. So I started my career, I worked on an inpatient unit at McLean Hospital, which is one of these old psychiatric hospitals, started in 1812 in Boston, and then ended up moving to Belmont, Massachusetts. Um, and I worked on an inpatient unit, schizophrenia and bipolar. So it's a big enough hospital where they could actually divide up the units based on diagnoses. So pretty much to be on this unit, one needed to have a psychotic condition. And so it was very intense. We were also teaching residents on that unit, which I loved. I always loved the teaching part. And people would come in. It was, people were in acute distress, hearing voices, often suicidal, or had made a suicide attempt. We were using lots of medication, lots of electroconvulsive therapy or ECT. And we could get people better. I mean, we were saving lives, I would say, get pulling people out of these episodes. But after sometimes a week or sometimes 2 weeks or 4 weeks, we would discharge them, and unfortunately, they would often come back. They would leave the unit. They would take these medications, often antipsychotic medications, and they just decide to stop them. And I've told this story before, but it's at the time, how I was trained was to say, oh, this person is non-compliant with their treatment, sort of blame them. Um, and really, in reality, the medications weren't helping them all that much once they got out of their acute episode. They were causing huge metabolic disturbances in people, huge weight gain from these atypical antipsychotics. And now now knowing a lot more, I don't blame these folks for stopping these medications. They were making a rational choice. They may have gotten out of their episode, but they weren't getting back to their level of functioning, and they were gaining lots of weight and not feeling healthy, not feeling functional. Why would they keep taking those medications? But at the time, our mantra was sort of blame them, and also say that their illness came roaring back when they stopped the medication. We also now know that there's withdrawal symptoms from stopping medications abruptly, and
Right.
it's not just their illness coming back; they were in withdrawal from their antipsychotic medications.
Wow.
So I wish I knew then what I know now,
Sure.
but we can say that about a lot of things, I think. Yeah.
Yeah, absolutely. So what kind of environment, I know this is very general, but what kind of environment were these people being released back into? I'm guessing that if they're already having a lot of episodes, it's probably not the best situation that they're even going to go back into. Is that correct?
Sometimes, yeah. I mean, it really varied at a hospital like that because it's a private hospital, but we also took people, kind of all comers who came from an emergency room. So some people were going back to a homeless shelter. Some people were going back to a nice house with their family. But either way, people weren't having great outcomes with these illnesses, with the treatments that we were offering in the long term. Like I said, I think we could save people's lives. We can get them out of their acute episode. But in terms of returning people back to their previous level of functioning, we just weren't able to do that.
Interesting.
That would almost never happen with
Yeah.
those illnesses. Yeah.
With the therapy that you described with the electrical, I can't remember what the acronym was, but can you explain what that is like? I heard things about it, but I don't actually know what it is.
Yeah, I mean, this is quite a controversial topic. I'm happy to talk about it a little bit. So the term is ECT, or electroconvulsive therapy. People think about the movie One Flew Over the Cuckoo's Nest with Jack Nicholson, and at that, the depiction of that is sort of this barbaric treatment. Um, and it's basically, it's been changed. It's become much more modernized with, real anesthesiologists, and, someone is put to sleep essentially with anesthesia. There's electrodes put to the side of the head, and a brief current gets passed through the electrodes, which essentially induces a seizure. And the seizure lasts anywhere from 30 seconds to 90 seconds. And it's a very effective treatment for very acute, very serious symptoms, whether it be severe depression with suicidality, or catatonia, or very severe psychosis or mania. It can be sometimes really life-saving. I've seen it save lives dozens of times, but it is a very serious treatment with lots of terrible side effects, including memory issues, which happen, which are often temporary. But I've certainly had people under my care who are convinced that the ECT course has caused some permanent loss of distant memories. And,
Interesting.
in the literature, that's a controversial topic, I would say, but I find it believable with some of these folks. I've spent many hours with them talking about the memories that they don't have, from not just recent periods right before their episode, which is common, but even distant memories that they just can't recover, they can't retrieve.
Interesting. Wow.
Um, yeah.
Wow. We'll obviously talk about diet here in a few minutes, but it reminds me of something that our mutual friend Nicole Laurent mentioned on our show. That, like, if you have been treated for some of these diseases, what you have gone through is already very difficult. Changing your diet is not going to be as difficult as whatever it is you've been treated with in the past. I think that's an example of something that, yes, can be very helpful, but also is very challenging and difficult. And changing the diet is not going to be, that hard, I guess. Um, and so I did want to ask you also, what was the story with your own family suffering from mental health issues as well?
Yeah, so around 8 years ago, I have three sons, and two of our sons became very ill almost overnight. It was unbelievable. So, happy, well-adjusted kids. One of them was 12 at the time, and one was 14, and they just, fell apart, literally. And it looked very mental health in the beginning. Lots of obsessions, severe depression, suicidality, totally unable to focus and concentrate. They couldn't go to school. It was, literally, they went from happy, well-adjusted kids to completely being unable to function. And, we tried to get help through initially psychiatry because it seemed very psychiatric. and therapists, they were literally being made worse by the medications, which for me was very hard to see or even accept and believe, given that that was my, my trade literally was of no use to them. And eventually we figured out that they had a condition called PANS, pediatric autoimmune neuropsychiatric syndrome, or also known as PANDAS, which is due to streptococcus. That's a more common term. Turns out that it can be caused by any kind of, not any infection, but lots of different infections can cause this autoimmune encephalitis, or essentially the immune cells attacking parts of the brain. Um, and this led us into a very deep dive into functional medicine, environmental medicine, all kinds of treatments that I could not have ever imagined that I would be authorizing for my kids to do, things that are not considered standard of care, very alternative in some cases. Some of them were just intense, very medical treatments like IV antibiotics. Um, but we did a gamut of other things, including nutritional interventions. And, it was really, that all those intensive alternative interventions that eventually, had some traction and where they got the most benefit. Um, so, I mean, it's just an unbelievable experience, but incredibly eye-opening for me as a clinician, seeing that the regular standard allopathic treatments that I knew had no benefit for my kids, and really getting that experience of being in the position of, regular medicine's not helping, we have to find something else. And so I really know what that's like. I have so much more empathy for the people that I treat and the families that I work with, since that experience, knowing that, the standard stuff sometimes really doesn't provide a good enough response.
Yeah. Wow. I've been trying to think for a while now what it would be like to be in your shoes and not only seeing your kids suffer, like that's bad enough, but also knowing that what you had learned was not necessarily helping where you thought maybe it could. The combination of those two things must have been utterly hopeless. It must have felt really dark.
It was really tough. Yeah, I mean, my wife and I, were together in this, and we, really circled the wagons and supported each other. But it was some incredibly dark months and years that we went through. Incredibly challenging. We really had to dig super deep, and of course had, we had really supportive family members as well and friends that helped us out. But it was really, it was very intense, incredibly
Yeah.
intense for a number of years there. And interestingly enough, when I was in the midst of that, my wife ended up having to mostly stop working because she was, you know, so involved in making sure the treatment was happening. I had to keep working to try to pay for all these treatments because a lot of it wasn't covered by insurance. And in addition, I had sort of another part-time job, learning all this functional medicine so I could figure out, whether we were going to follow various recommendations that we were getting. And I don't know, your listeners may have this experience, but in functional medicine, there's a lot of focus on root cause, trying to find answers, but there's also so many things that are being offered and so many things to choose from. There's 20 or 30 different tests, whereas the regular doctors are only offering one or two tests. And how do you choose which of these to do and which of these treatments to do, and how aggressive do we want to be, these things. So it really required, in my view, like I had to do a deep dive on all of these things. So it was quite an education at the same time.